In early 20th century New York City, healthcare for black residents was limited and often outright discriminatory. Many hospitals refused to admit black patients, and when they did, they were relegated to overcrowded and under-resourced segregated wards. Black doctors, nurses, and medical students struggled to find work or training opportunities in mainstream hospitals, leaving the community with little access to qualified care. Illness and injury were compounded by systemic neglect, making even routine medical treatment a struggle. Faced with these barriers, black New Yorkers realized they could not wait for change from a system that consistently excluded them. Communities began pooling resources, fundraising, and organizing to create their own healthcare institutions, hospitals that were owned, staffed, and run by black professionals. These hospitals were more than medical centers, they became symbols of pride, resilience, and self-determination. They represented a refusal to accept second-class treatment and a commitment to the health and well-being of the community. Funding these hospitals required creativity and sacrifice. Churches, fraternal organizations, social clubs, and civic groups worked tirelessly to collect donations, purchase medical equipment, and support staff salaries. Community members often contributed what little they could, from small monetary donations to volunteering their time. Every brick laid, every bed purchased, and every nurse trained was a testament to collective effort and determination. These hospitals became safe havens where patients could receive care without fear of discrimination and where young black medical professionals could train and gain experience. One of the most significant examples in New York was Sydenham Hospital in Harlem, which became a hub for black medical professionals and patients. While it was initially not black-owned, the community played a central role in supporting its operations, and other smaller clinics and hospitals across Harlem and Bedford-Stuyvesant were fully funded, built, and operated by black New Yorkers. These hospitals not only treated patients but educated communities about hygiene, nutrition, maternal care, and disease prevention, information that was often inaccessible due to systemic racism. Operating these hospitals was never easy. Funding was always limited, facilities were frequently overcrowded, and staff worked under enormous pressure. Yet the hospitals persisted because the community believed in their mission. They saved countless lives, trained generations of black doctors and nurses, and created spaces where black patients could experience dignity and respect in a world that too often denied them both. The legacy of these hospitals is profound. They demonstrated that black communities could organize, fund, and maintain essential institutions even under systemic oppression. They laid the groundwork for civil rights activism in healthcare, influencing future movements to demand equitable medical treatment and access. Perhaps most importantly, they showed that self-determination and community solidarity could create